Assalamu alaikum wa rahmatullahi wa barakatuh. Greetings to you all. In this video, I'm going to actually read this scientific paper. The title of this paper is Press Pulse, a novel therapeutic strategy for metabolic management of cancer. This is the sixth part of this video series, and in this part, I'm going to start reading from the results section, but the subsection that I'm going to start from is this one, where it says psychological stress reduction, a press disturbance. If you want to, you should basically refer back to the older or the other videos to basically, if you just want to go through the whole paper. So without further ado, let's start. So this is the results section, and the subsection is called, or the subsection's title is Psychological Stress Reduction, a Press Disturbance. Chronic psychological stress is known to promote tumorigenesis through elevation of blood glucose, glucocorticoids, catecholamines, and insulin-like growth factor, IGF-1, like IGF-1. Reference 233-234. In addition to calorie-restricted ketogenic diets, psychological stress management involving exercise, yoga, music, etc. also act as press disturbances that can help reduce fatigue, depression, and anxiety in cancer patients and in animal models. Reference 235 through 238. Ketone supplementation has also been shown to reduce anxiety behavior in animal models. Reference 239. The mechanism of action of psychological stress management for cancer control would largely involve reductions in blood glucose levels that contribute to tumor growth. Subsection: restricted ketogenic diet used with 2-deoxyglucose. Calorie restriction or therapeutic fasting is anti-angiogenic, anti-inflammatory, and pro-apoptotic, and thus targets multiple cancer hallmarks. Reference 114, 166, 167, 170, 171, 182, 240 through 243. This physiological state also enhances the efficacy of chemotherapy and radiation therapy while reducing the side effects. Reference 244 through 246. Indeed, lower dosage of chemotherapeutic drugs can be used when administered together with calorie restriction or restricted ketogenic diets, in short KDR. We showed a synergistic interaction between KDR and the glycolysis inhibitor 2-deoxyglucose, or 2DG, for the metabolic management of the syngeneic CT2A malignant mouse glioma. Reference 247. It was interesting to find that 2DG 25 mg per kilogram had no therapeutic effect on the CT2A tumor growth, and when administered alone to mice on a standard high carbohydrate diet. Sorry, let's read it again. It was interesting to find that 2DG 25 mg per kg had no therapeutic effect on a CT2A tumor growth when administered alone to mice on a standard high carbohydrate diet, but had a powerful therapeutic effect when administered with a KDR. Indeed, this relatively low dose of 2DG became somewhat toxic when used with the KD, suggesting that lower dosing of some tumor-targeting drugs could also be effective when administered with KDR. Besides 2DG, a range of other glycolysis inhibitors might also produce similar therapeutic effects when combined with KDR, including 3-bromopyruvate, oxaloacetate, and lonidamine. Reference 58, 186, 248 through 250. In the example here, the KDR is the press making cancer cells selectively vulnerable to death, and the 2DG is the pulse, which could be used intermittently or cycled to avoid toxicity. Next subsection: ketogenic diet used with radiation therapy. Adrian Sheck and colleagues showed that the therapeutic efficacy of radiotherapy against the orthotopically grown GL261 mouse glioma could be greatly enhanced when combined with commercially available ketogenic diet, reference 183. Mice fed the ketogenic diet had elevated levels of beta-hydroxybutyrate and an increased median survival of approximately 5 days relative to animals maintained on a high carbohydrate standard diet alone. A synergistic interaction of the ketogenic diet plus radiation was seen, as no bioluminescent signal was detected in 9 of 11 that received the combined treatment. Furthermore, no signs of tumor recurrence were seen for over 200 days when the treated mice were switched to the standard diet 101 days after tumor implantation. These findings suggest tumor resolution in some of the mice treated with the combined therapy. In this example, the ketogenic diet is the press and radiotherapy is the pulse. It is important to recognize, however, that the radiotherapy used in glioma patients can damage the respiration of normal cells and increase availability of glutamine in the microenvironment, which can increase risk of tumor recurrence, especially when used together with the steroid drug dexamethasone. Reference 31, 251 through 253. Next subsection. A ketogenic diet used with hyperbaric oxygen therapy. Poff and colleagues demonstrated that hyperbaric oxygen therapy, or HBOT, enhanced the ability of the ketogenic diet to reduce tumor growth and metastasis. Reference 40. Evidence in animal models and in humans suggests that HBOT may have a modest anti-cancer effect when used alone, reference 254, but appears most efficacious when it is used in combination with standard care. Indeed, HBOT has proven effective when used prior to radiation therapy for GBM, reference 255. The mechanism of HBOT in tumor management is not yet clear, but saturating the tumor with oxygen could reverse hypoxia and suppress growth. Reference 254 to 56. HBOT also increases oxidative stress and membrane lipid peroxidation of GBM cells in vitro, reference 257. The effects of KD and HBOT can be enhanced with administration of exogenous ketones, which further suppressed tumor growth and metastasis, reference 190. Besides HBOT, intravenous vitamin C and dichlorocetate DCA can also be used with the ketogenic diet to selectively increase oxidative stress in tumor cells. Reference 258-259. Recent evidence also shows that ketogenic supplementation may enhance or preserve overall physical and mental health, reference 260-61, which are often compromised due to disease progression and standard of care therapies. Under these conditions, the ketogenic diet with exogenous ketones serve as the press, while HBOT serves as the pulse. Although HBOT and radiotherapy kill tumor cells through oxidative stress, HBOT is less toxic to normal cells than is radiotherapy. Next subsection. Calorie restriction used with glutamine targeting for metastatic cancer. Some tumors use glucose as prime fuel for growth, whereas other tumors use glutamine as a prime fuel, reference 102, 186, 262 through 264. Glutamine-dependent tumors are generally less detectable than glucose-dependent ones under FDG PET imaging, but could be detected under glutamine-based PET imaging, reference 265. Glutamine targeting should have therapeutic benefit against those tumors that depend on glutamine for growth and survival. We found that the highly metastatic VM-M3 tumor cells are dependent primarily on availability of glutamine for growth and ability to spread systemically. Reference 108. The glutamine inhibitor DON 6-deoxo-5-oxo-L-norlicin has shown therapeutic benefits in the clinic as long as toxicity can be managed. Reference 186-66. DON could work best when combined with inhibitors of glycolysis such as lonidamine, reference 186. In addition to DON, other glutamine inhibitors like bis-2,5-phenylacetamido 1, 2, 4-thiazole 2-ill-ethyl sulfide, BPTS or CB839 could also be therapeutic in targeting glutamine-dependent tumors. Reference 267. A greater attention to possible adverse effects will be needed for glutamine targeting than for glucose targeting, as glutamine is involved with several essential physiological functions, especially for the cells of the immune system. Reference 268 to 269. It might therefore be necessary to also periodically schedule glutamine supplementation with glutamine targeting to obtain maximum therapeutic benefit while protecting immune system function. The VM-M3 tumor is an excellent model system for evaluating the role of glutamine as a metabolic driver of invasive and metastatic cancer. The VM-M3 tumor arose spontaneously in the brain of its syngeneic immunocomponent VM/DK inbred mouse host. Reference 270. The tumor was classified as a glioblastoma (GBM) based on the histological appearance, invasive growth behavior in brain, and systemic metastasis when given access to extraneural sites. Reference 271 to 277. The neoplastic VM-M3 tumor cells share several characteristics with mesenchymal microglia or macrophages, which are abundant in GBM and use glutamine as a major fuel. Reference 278 to 79. Although calorie restriction could partially reduce distal invasion of VM-M3 tumor cell in brain and reduce primary tumor growth in flank, calorie restriction did not prevent systemic metastasis despite causing reduction in blood glucose and elevation of ketone bodies. Reference 108 to 80. However, DON had a major effect in reducing both primary tumor size and systemic metastasis, indicative of the importance of glutamine in driving the tumor. Reference 108. The synergistic interaction was also seen when DON was combined with calorie restriction. Reference 281. Modifications of DON scheduling, timing, and dosing would be needed to improve efficacy and reduce toxicity. In this example, CR is the press and DON is the pulse. As glutamine is a major fuel of immune cells, glutamine targeting should be effective in reducing most metastatic cancers that have characteristics of macrophages and other immune cells. Reference 121. In this part, I'm going to stop here, and I'm going to make another video and start from the next subsection, which the headline is, or the title for that subsection is Optimization of Scheduling, Timing and Dosing. So, yeah, hope to see you in the next video. Take care then. Bye-bye.